So query from Hadgaon Tehsil, Maharashtra. The first and foremost problem which I face nowadays is the number of OPD and new patients. There is a drastic fall in number of new OPD and new patients, those who come with unrealistic expectations of charges and results. They don't trust doctor anymore. They just want a good deal that with some sort of guarantee warranty. So number of OPD and new patient, drastic fall because maybe you come across as one of the other doctors in your area. If they don't trust you, probably you may not have delivered to them in the past, or maybe their references in the past, or maybe you have become prone to bargaining in the past. That is why they're coming to you with a good deal option. Trust me, nobody dares to talk such a word in my clinic. Yes, they may say jokingly sometimes, Doctor, aap to karke package hi bana do. And there is nothing. I say it with a straight poker-faced face. Sorry, there is nothing called as a package in healthcare. The labs may offer it, maybe the surgeons may do it, but in the private clinics, there is nothing called as a package. I'm sorry if you're expecting anything. I'm sorry to hurt your expectations, but I'm sorry, this won't be possible. Just stay with a poker face. If you say, you're making yourself prone to bargaining. Don't go into that zone. Somebody even asks you for a good deal. Nothing doing. I'm sorry. This is not a goods shop or a product industry. This is a service industry. And guarantee warranty, there are so many ways to deal with it. I have so many videos made on YouTube for that. You can watch them. You probably writing up this query mentions me that probably you have not gone through any of those videos. So please, you can say, take out time to go through those videos. It will help you only. So retention of the patient is also a big issue. Those patients who got treatment from me over 10 years now have shifted to another dentist due to many reasons, which include cost, rate, convenience. That is your thought process. That is absolutely your thought process that they have shifted. Did the patients give you this reason? We shifted because you belong to a different community. You belong to a different caste. By that standard, I will have a dearth of patients because we are one of the biggest minorities in India. We are just 2% in India, not even 2%. And all India has 2%. And we are scattered, the Sikhs, I mean. We are scattered all over India. So Punjab mein to hai sirf 1-1.5%. So bad. I'm not having any patients. So bad. If I were to think in that regard. So don't think in those regards. It is not a matter of that. It is your thought process which is making you believe that probably these are the reasons. Caste, rate is your choice. I don't go into that part. Pricing is always subjective because what we think if the patient is gone, it is because of that. Convenience can be related to CX also. Yes, people change dentists. Sometimes you are far off and they get a good option nearby. So they will do that. But then that is only a few category of patients. If all your patients have started doing that thing, or majority of your happy, satisfied patients have started doing this thing, then you really need to do an introspection that where lies the problem. If you are not introspecting properly, then there needs to be surely some leeway out. What is the fault at your end? Many times we are not ready to even pinpoint the fault at our end. And we are not ready to look into those factors. And if we are not ready to look into those factors, the results are not going to come. Discrepancies in rate. If we all don't want to unite under one platform, who's to be blamed? We only. You can't say, wo nahi karta, main nahi karta, isliye nahi karta, isliye nahi hota. Even a pity safai walas have a union. A puncture walas have a union. A scooter repair walas have a union. Name the, you can say industry, they have a union or a, you can say an association. We have a namesake association only. 25% membership. And 25% guys, just talking from numbers point of view, 25% members means 25 is minority because 75 is majority. 75% are not members. So discrepancies in rate because nobody teaches these things and people are not aware of their costing and numbers. They blame dentistry, they blame mushrooming of colleges, they believe mushrooming of clinics, as your point number D also says it. न्यू डेंटल क्लिनिक यार 150 करोड़ की आबादी है, सारे भी प्रैक्टिसिंग डेंटिस्ट हो ना 3 लाख हैं सिर्फ इंडिया में. 3,02,000 ऑफिशियल नंबर ऑफ DCI. चेकआउट DCI वेबसाइट में, आपने से नहीं बोल रहा हूँ. 3,02,000. नॉट ऑल आर प्रैक्टिसिंग. मेरे 80% बैचमेट्स नहीं कर रहे प्रैक्टिस. 1,80,000. लेट्स से 2 लाख प्रैक्टिसिंग. 66% आई एम सेइंग. 2 lakh people against 150 crore. Give that logic to someone else. Even if you say the urban and the rural India, you can say 2/3 and 1/3 again, 70%, 30%, 50 crore against 2 lakhs. Is it still more or less? Stop giving excuses to yourself on this, that we are having huge competition. एक शहर में 10,000 लोग हो जाएंगे ना वैसे, then start saying of competition. Then start saying of competition. There is nothing called as competition. We have mentally made ourselves believe हम सक्सेसफुल नहीं हो रहे हैं. इसका ये कारण है, किसी के सिर पे तो ठीकरा फोड़ना है ना, तो फोड़ दो मशरूमिंग ऑफ कॉलेजेस पे, फोड़ दो प्राइसिंग पे. अपने अंदर तो झांकना नहीं है ना किसी ने. Who will do the introspection? 2 लाख लोग, 50 करोड़ अर्बन पॉपुलेशन की बात कर रहा हूं, रूरल की तो बात ही नहीं कर रहा हूं. 50 करोड़ अर्बन पॉपुलेशन, 2 लाख डेंटिस्ट, and we talk of saturation. Bullshit approach to every such dentist in India from my side who says this thing. 2 lakh against 50 crore or 2 lakh या 3 lakh against 150 crore. Stop giving these excuses. The problem is, I mentioned in the morning also, we have started to enjoy being a victim. उसमें मजा आता है, दर्द में ही मजा है. इस दर्द में जीने दो बाबूजी. That is the logic. People, you can say, sitting at a bar, competing with it. 3 months, not seen a single naya paisa in my profit, in my clinic. Another one, 3 months, 3 years since COVID, not seen a single rupee. It becomes an ego battle. Who's more berserk? Who's more, you can say, laggerhead? Who's more conjuice? Who's more not making money? We stop realizing being victim is not the solution. Not enjoying victimhood is the solution. Action taken. क्लिनिक सजा सजा के राजा जी बैठ गए. दुनिया को कौन बताएगा राजा जी के पास सामान बहुत अच्छा है, स्किल बहुत अच्छी है? आप ही बताओगे. अगर आप नहीं पहुंच रहे हो अपनी ऑडियंस के पास, तो जो आ रहा है वो लेते रहो. नहीं, वन डे सूरज वेस्ट से उगेगा और दुनिया को पता लग जाएगा कि मैं एग्जिस्ट करता हूं. वो दिन नहीं आएगा, वो ईस्ट से ही उगेगा सूरज. इतना याद रखो. If you keep on relying this thing, God has been not kind to you, you need to remember the world has changed after COVID. The day you start realizing it is all a game of visibility now. हर बंदा तो नहीं आपके क्लिनिक के आसपास जो खोल के बैठा वो विजिबल है. That is the reason we are falling back to the spray. Lack of promptness to write down all paperwork. Patient refuses to sign consent after reading it because your logics are wrong. Consent is not to be read. Consent is first verbal, so that the written becomes a formality, just a formality, documentary formality. Simple way to convey. The problem is we have internet से निकाला consent form, print out किया, लो ये फॉर्म साइन कर दो, लाइक द दीवार, शशि कपूर ऑफ दीवार फिल्म. दो भाई साइन कर दो. नहीं करेगा वो साइन. क्यों करेगा वो साइन? यू आर गिविंग हिम अ डेथ वारंट. कि वो फार्माकोलॉजी में पढ़ा था ना, क्या होता है? नोजिया, वॉमिटिंग, अर्टिकेरिया, एंजियोडीमा एंड डेथ विद एवरी ड्रग. किसी भी फार्माकोलॉजी की ड्रग का साइड इफेक्ट आ जाए. दैट इज हाउ वी हैव डन. यू राइट द टूथ माइट बी लॉस्ट, द टूथ माइट बी परफोरेटेड, द टूथ माइट हैव अ सेपरेटेड इंस्ट्रूमेंट इन एन एंडो कंसेंट. क्यों कोई साइन करेगा? सारी नेग्लिजेंस करके भी ठेका तुमने लिया है, वो करेगा साइन. व्हाई शुड ही? देयर इज अ वे टू कन्वे, एंड कंसेंट मींस प्रोसीजर टू ऑपरेट एंड टेलिंग देम ऑफ द पिटफॉल्स व्हिच आर पॉसिबल. अब कहो कि सब कुछ होना ही होना है, वी वोंट टेक एनी रिस्पांसिबिलिटी इफ द इंस्ट्रूमेंट सेपरेट्स. और क्या भगवान जी ने आके बीच में तोड़ दिया इंस्ट्रूमेंट? आप ही ने तोड़ना है ना. नई स्किल सेट है तो मत करो यूज रोटरी. नहीं आती प्रॉपर्ली तो डेलीगेट. द फर्स्ट क्वेश्चन है डू, डिफर, डेलीगेट, डिलीट. If you can't identify what you want to do and learn on those and implement on those and delegate the rest. Back bitching by fellow dentist. If you are doing back bitching, he'll also do back bitching. Call up that dentist. Meet them over a cup of tea. Meet them over a cup of over a lunch. Make a union in your area. That we guys, आइडिया तो चलो कुछ है, करती है नहीं करती है, लीव दैट पार्ट. हम लोग अपने एरिया के यूनियन बनाते हैं. टेक एन इनिशिएटिव. सारे एरिया के डेंटिस्ट इकट्ठे हो जाओ, कर लो. हम लोग इस रेट से कम काम नहीं करेंगे. मेरा रेफरेंस दे दो. मैंने उनके वीडियोस देखे थे. इतनी कॉस्टिंग पड़ती है इस क्राउन की, मैं भी ये मटेरियल्स यूज करता हूं. आप भी ये वीडियो देखो. आपकी कॉस्टिंग अगर आपको अलाउ करती है तो इससे कम में काम मत करो भाई लोग. प्रॉफिट नहीं आएगा. When all of you in one area only unite, बैक बिचिंग अपने आप गायब, कंपटीशन गायब, प्राइसिंग गायब, सब गायब हो गया. इट ओनली नीड्स वन इनिशिएटिव. लेकिन नहीं, वो ग्रैश ओवर में आता था ना, हाय मैं शर्म से लाल हुई. किसी डेंटिस्ट को कॉल करने में हम शर्म से लाल हो जाते हैं. वाई इसलिए ही इज अ प्रोफेशनल ब्रदर और अ सिस्टर. इट्स ओके. अंडरस्टैंड. नेशनल लेवल पे जब होगा तब होगा, स्टेट लेवल पे तब होगा, लोकल लेवल पे तब होगा. एरिया लेवल पे तो कर लो यार. छोड़ो एरिया लेवल पे, मोहल्ला लेवल पे तो कर लो. You 10 people decide we are not going to charge below that. Who's going to do it? Once you make things clear to each and everyone, भाई इससे नीचे जाओगे तो अपनी कबर खुद खोदोगे, प्रॉफिट नहीं मिलेगा. Why will people do it? मेरे एरिया के एक्सेप्ट वन, ऑल माय डेंटिस्ट नेबर्स आर इन माय व्हाट्सएप कम्युनिटी, शेयरिंग प्रैक्टिस मैनेजमेंट एंड फाइनेंस विद मी. इट्स योर चॉइस वेयर यू वांट टू बिलीव इट और नॉट. वो एक जो है उससे कोई हमारी लड़ाई नहीं. वो बंदे एंटी सोशल नॉट इन रॉन्ग वे, बट वो सोशल मीडिया से दूर भागने वाला. तो दैट इज व्हाई ही इज नॉट देयर. वी मीट ओकेजनली, वी टॉक ओकेजनली, बट दैट्स ओके. यू हैव टू अंडरस्टैंड, इनिशिएटिव तो किसी न किसी को लेना पड़ेगा ना. नहीं करोगे तो विक्टिमहुड एंजॉय करते. इट इज योर चॉइस.